eloquently speaking. Welcome back to another episode of Legal Talk, where law meets justice and advocacy becomes action. I'm your host, Dr. Vickie Simon, and this episode we break down legal, policy, and government issues that impact our everyday lives, and also tackling an issue that sits right at the intersection of public health and racial equity and local government accountability. Maternal care in Atlanta and Fulton County, and how the city's budget decisions are putting some of our most vulnerable residents at risk. So here's a real question I want you to sit with for a moment. What does the city budget say about who matters? Here in Georgia, we know maternal health is in crisis. The state has one of the highest maternal mortality rates in the nation, and Black women, especially in underserved communities, are dying at 3 to 4 times the rate of white women. This isn't just about healthcare access, it's a systematic issue that goes straight to the heart of justice and law. Because when preventable deaths continue under the watch of public institutions, and budgets fail to prioritize life-saving care, we have to ask, is the government meeting its constitutional and civil rights obligations? That's the lens I used in the recent analysis of the Fulton County health budget, focusing specifically on how maternal care programs are funded or underfunded and what that says about our legal and moral responsibilities. Now let's start with the numbers. The Fulton County Board of Health allocates around 5.2 million to maternal and child health programs. That includes prenatal care, family planning, mobile clinics, and outreach. But here's the breakdown. 40% goes to staffing. That covers nurses, educators, and clinic workers. 25% supports clinic operations and supplies. Only 20% is dedicated to outreach in underserved communities, and the remaining 15% is administrative overhead. Now, in theory, that might sound like a decent spread, right? But in practice, it's not reaching the people who need it most. Moms in South Atlanta and zip codes with high rates of preterm birth and low access to clinics. And the situation is even more fragile than it looks. Just this past spring, the Fulton County Board of Health laid off more than a dozen employees due to funding shortfalls. These weren't administrative positions. Many were frontline public health workers. That included staff from maternal health and HIV prevention programs. And while some HIV related jobs were restored after public pressure and last minute funding, the damage was done. Communities relying on those services experienced disruption. It's a live example of what happens when budgets are built for sustainability. Then add this. The CDC rescinded over 11 billion in public health funding nationwide, and Georgia is feeling the sting. Local health departments across the state are bracing for deeper cuts, including maternal care programs. When federal dollars disappear, Fulton County doesn't always have the local reserves to make up the difference. Now let's zoom out for a bit to analyze this. I use a public budgeting theory from Irene Rubin's book, The Politics of Public Budgeting: Getting and Spending, Borrowing and Balancing. It argues that the budget isn't just math, it's political, it's personal, and it reflects who holds power and influence. Now, in short, budgets are moral documents, and if underserved mothers, particularly Black mothers, aren't part of the political conversation, their needs do not get prioritized. That's exactly what we see in the current maternal care budget. Funding decisions reflect political visibility, not community urgency. But let's give credit where it's due. Some innovation is happening. In September 2025, Fulton County launched a guaranteed income pilot that gives $1,000 a month to pregnant women in certain zip codes with high rates of premature births. That's right. The goal is to study how financial stress affects pregnancy outcomes. It's bold, it's evidence based, and it shows that direct financial support can be a part of a broader maternal care strategy. But here's the thing, it's just a pilot, not a permanent program. It's not embedded in the core budget, and without long term funding, it may not last. This is the difference between temporary aid and structural investment. Now, let's bring this back to law and justice. If a public budget consistently disadvantages one group, even unintentionally, that's a civil rights issue. Under the Title VI of the Civil Rights Act, recipients of federal funds cannot discriminate, even by impact. The way funds are distributed must be equitable. There's also the question of due process and equal protection under the 14th Amendment. If local government fails to protect a basic right, like life-saving maternal care for a specific group, are they fulfilling their constitutional duty? These aren't just theoretical questions. They are the kinds of issues that could fuel future lawsuits or Department of Justice investigations. Remember, Flint, Michigan? Budgets have been consequences, and they often mirror or reinforce structural racism. So, what can Fulton County do and other local governments do differently? First, stop relying so heavily on grants. Build maternal care into the general fund. Make it a priority, not a patch. Second, mandate annual equity reviews of health spending. If certain populations are consistently underserved, that needs to be flagged and it needs to be fixed. Third, expand participatory budgeting and include moms from underserved areas in deciding how funds are spent. And fourth, increase funding for outreach programs, mobile clinics, and community health educators, because care only matters if people can actually access it. Here's a worrying development. In late 2024, the state of Georgia disbanded its Maternal Mortality Review Committee. That committee was responsible for analyzing maternal deaths and making policy recommendations. It was dismantled after a confidential data leak, but its absence leaves a huge gap in accountability. Without a functioning review board, how are we supposed to know what's working and what's not? How can we justify budget decisions when we're literally turning off the lights on the data? Here's what I want to leave you with. Budgets are legal documents. They are binding statements of value. They tell us who is seen, who is heard, and who is protected. If Atlanta, Fulton County, wants to say it values maternal health, especially for its most vulnerable residents, then that message has to show up in the budget, not in a pilot program, not just in speeches, but in reoccurring, protected, equitable funding. Because justice isn't just about what happens in the court, it is also about what we fund and who we invest in. If today's episode moved you, informed you, or sparked a question, share it. Start a conversation. Talk to your city leaders. Speak up, because change starts with what we choose to notice. When the system breaks down, we build it up together. Legal talk isn't just commentary, it's resistance. Let's make sure that this is one of many episodes that not changes just minds, but changes policy. I'll see you on the front lines of reform. Until next time, stay informed, stay ethical, and keep serving your community.